In the meantime, we have Dr. Sachin Shah. Hi, Sachin, how are you?
Hi, Stan. Pleasure to see you again, although
Yeah,
always virtually.
yeah.
One day we'll be face to face.
At some point, hopefully this summer, definitely in the fall semester, we'll be back on campus doing these and in a hybrid fashion, both remote, virtual, as well as on site for those of it that can join. But most importantly, again, we have Dr. Sachin Shah, who's with us today. And again, one of the leaders in the life sciences globally in health data sciences and data science in life science, and a global medical partner for health and devices in GSK, one of the largest manufacturers in the world in life sciences. And Sachin, maybe you could start off by telling the audience a little bit about your background.
Yeah, certainly. So clinician by background, and I left clinical medicine maybe about 3-4 years ago. And since then have predominantly worked in health technology. Previously worked at a startup called Medopad, now known as Humor. And now work at GSK, focusing on the consumer side for digital health and devices. My areas of specialty are the ideation, creation of digital health products and ecosystems, and working closely with product and design teams and user research and user experience guys to really develop products that consumers or end users will really value. And more recently, been focusing on how do we clinically validate these digital products? So how do we show that these are safe, effective, and efficacious digital products in the real world, whether that's just for paper evidence generation or claims, or for regulatory submission and approval.
That's brilliant. And obviously, you've been a busy person over the last couple of years with everything that's going on, with the amazing number of expedited use authorization approvals that the FDA has issued out in not just in molecules, but in devices and digital health. And that's the area that you support. And so tell us a little bit about the trends that you're seeing now, moving from a pandemic, as we saw from Dr. Fauci, to endemic stage of this phase of human history. How has this changed life in GSK for you?
Oh, I was just having this conversation with someone the other day. I feel like for a long time, big companies were sort of jumping on the bandwagon of digital health just as a tick box exercise. We need to show that we're involved in the future. But the real mainstream was still obviously, creating products and creating organic compounds. I think since the pandemic, I've seen a real shift in focus from, senior level management and C-suite executives around actually, this is something that we need to pour more and more resources, time and effort into. And I think people have now started to reap the benefits of the implementation of, say, digital solutions in clinical trials. People are seeing that sort of cost-based analysis effect, maybe 5-10 years down the line. So I think overall, from a company point of view, digital is a massive, massive focus. I would say for probably quite a lot of life sciences companies now, I think everyone is no longer just joining the bandwagon for the sake of joining the bandwagon, but actually want to become key players in this digital ecosystem. And I think we see it all the time, right? We see all in the media partnerships with big companies, with small companies, with middle-sized companies, with academic centers, with consultancy companies. So it's completely changed. And the pandemic, I think, has been a really good pushing point for getting everyone on the same board.
And what kind of startup advice would you have for folks? A lot of the folks on the call right now are startups, and they're looking for advice. You've got some great experience with one of the fastest growing startups in digital health with Metapad/Huma. Congratulations on that, by the way. I hope you still have stock from that company. And now you're working at one of the largest manufacturers in the world. And so you really do have a good perspective from both sides of the coin. What can you give our audience? What kind of advice can you give to them, on how to approach larger stakeholders and try to find ways to collaborate?
Yeah, and I think that's the key. I think for me, it is really, really pushing that it's no longer a supply and demand of a service provision, right? I think pharma needs to stop going to startups with like, we want to do this, here you go, come back when it's finished. And I also think startups need to really show the benefit that they will give to companies like GSK or any big company about how partnership models can really benefit. I'm a really big fan of this partnership model because I think startups are so good at creating innovative solutions to age-old problems, right? We all know how long clinical studies can take, how long they last, all the problems and costs that come with traditional clinical research. And there are so many now startups or smaller tech companies or health tech companies that have just completely broken down those stereotypic facets of clinical research to show that, you know, we can do this research quicker. For example, we just closed out a study working with Evidation Health, and participant recruitment for this decentralized study took 2 days. And when we talked to the head of clinical development, you know, they're like, that is mad. We've never had a study close out recruitment in 2 days. Where the pharma experience comes in, obviously, pharma and life sciences companies have spent years in the clinical research space or in the healthcare space, you know, getting products out to the consumer or to the patients. So actually, by working together, i.e. giving advice and guidance to the startups about that's fantastic, we love it, you know, we can help you with maybe the way you analyze your stats, or we can help you with logistics. Having those sort of partnerships are almost like a, you know, a mentorship in a way where both parties benefits from working with each other. I think that is like the key. If startups can demonstrate to a life science partner that we can make your life easier, but we don't compromise at all on the quality of the scientific rigor that is known with your company, then it's, you know, it's a lot easier upsell, because that's what everyone worries about, right?
It's precisely right. That's exactly the case. And that's what we're seeing more and more now, and more than ever. And again, Sachin, thank you very much for joining us today. Terrific insights, and really appreciate your time, and looking forward to catching up with you again when you're in New York City, and we'll do one of these in person.
Yeah, perfect. Always a pleasure.
All right. Take care.
Okay. Bye.